4. Peripheral sensory and SFN definitions and differences. Peripheral neuropathy, it includes all types of nerve damage that encompasses any condition where there is damage to the peripheral nerves outside the brain and spinal cord, which can include sensory, motor, and autonomic nerves. Nerves throughout your body that control things that happen in your body without you thinking about them. Breathing, sweating, and heart rate. This can be caused by diabetes, infections, autoimmune disease, physical injuries, exposure to toxins, and chemotherapy. Symptoms vary widely, but often include numbness, tingling, burning pain, muscle weakness, and coordination that a person feels initially in their hands and feet. Sensory neuropathy, which is damage to sensory nerves, is a type of peripheral neuropathy that affects sensory nerves responsible for transmitting information, such as touch, pain, temperature, and managing balance, coordination, movement from the body to the brain. It happens when there is damage to the sensory nerves responsible for transmitting data from our sensory organs, sight, hearing, taste, smell, and touch. In addition to the causes of peripheral neuropathy, sensory neuropathy also can include vitamin deficiencies and specific infections that targets sight, hearing, taste, smell, and touch. In addition to the symptoms of peripheral neuropathy, sensory neuropathy can also include pain and extreme sensitivity to touch that affects one's ability to perceive sensations accurately. And last, small fiber neuropathy is when peripheral neuropathy and sensory neuropathy evolves. It is a type of peripheral and sensory neuropathy because the nerves are outside of the brain and spinal cord that damages the small nerve fibers. SFN is confirmed by a biopsy and patient experience with sensory data. How did this apply to me, my experience and symptoms? First, understanding the differences can greatly help with discussions, symptom identification, diagnosing, and treatments. It is also important for choosing a physician that understands these conditions. When I was diagnosed by a neurologist, I'd been tracking my symptoms on an Excel spreadsheet for years, unaware that these symptoms were part of the autonomic system. I thought I was losing my mind because no one could tell me why or what was causing these symptoms, and nobody could see it. I had many lab tests and procedures to find out what was wrong with me. My neurologist at the time congratulated me on having both peripheral and sensory neuropathy. My EMG, that's an electrical current, and biopsy confirmed damage to my small nerve cells. I had a really hard time understanding the differences and explaining my sicknesses to those around me, sometimes including physicians that were not familiar with the condition. It can be frustrating for those of us with this rare, extensive disease because often neuropathy pain is associated to common diabetic neuropathy pain in the feet. It is hard to get anyone to understand that this small fiber neuropathy is a full body neuropathy. It is like being tased 24/7 with no relief. The symptoms I was having involved all of my senses: sight, hearing, taste, smell, extreme sensitivity to touch, and the severe chronic pain. How did that happen? Sight. My eyesight has changed slightly, amplifying existing issues. Eye pain and on-again, off-again blurriness. Hearing. I have constant loud ringing in my ears, often referred to as tinnitus, that I didn't have before. Taste. My mouth is extremely damaged, and this impacts foods that I eat or cannot eat. Often, no matter how much liquid I consume, my tongue is like a dried-up prune. This has impacted my eating and ability to speak and carry a conversation, as well as I have lost teeth from this disease. Smell. I can't say how specifically my smell is impacted, except that it is. Often what I think I smell is inaccurate, exaggerated, or non-existent. Touch. The nerves of my limbs are damaged. My hands look as if I've held them in water for hours. I have constant neuropathy, pain, tingling, stinging, numbness in limbs. It changes how I perceive pain, temperature, and use of my hands. And also why it takes me 10 times longer to type anything. Pain is the hardest because it isn't something that others can see, and this type of pain is exhausting because it's 24/7. I was not a stranger to pain. I don't have the expectation that I can be 100% pain-free. As this disease progressed, I learned to categorize my pain, and below are a few examples. So I already had osteoarthritis that caused me pain and inflammation. I had a couple of back surgeries. I've been dealing with this pain since my early 20s and had to have back surgery in 30s, but overall it's managed. Fibromyalgia caused all over muscle weakness, stiffness, and pain. I was diagnosed with fibromyalgia because all the other tests resulted in within normal range. Small fiber neuropathy causes almost full body burning, tingling pain 24/7. Sjogren's syndrome affects the endocrine system and causes dry and irritated glands, resulting in mouth, tongue, and vaginal anal pain. I've lost teeth. As part of SFN, gastroparesis causes gut, digestive, and back pain. The miscommunication from your gut to your brain and vice versa doesn't work because of the damaged small nerve cells in the lining of your organs, i.e. your entire digestive system. Joints are affected. I have cysts that come and go depending on my level of inflammation. I cannot use NSAIDs for inflammation and therefore suffer, as the only other alternative for me is steroids, and doctors are hesitant to prescribe. I had no pain relief for years, and for a short time I used alcohol to numb the pain. I was finally sent to pain management, where I received appropriate treatment for the pain, and I was able to stop using alcohol for symptom relief. What are my takeaways? Educate yourself on your types of pain. It goes along with understanding the disease. But understanding the differences can greatly help with discussions, symptom identification, diagnosing, and treatments. Find a physician that has an understanding of these conditions. I know the challenge of finding doctors to treat this disease, oftentimes having to wait for months to see someone. If you can't find a physician that understands, find one that is willing to learn. Find a tool to track your pain, whether it's on your symptom tracker or cell phone, and be consistent. I understand the difficulty in consistently tracking symptoms and pain, especially on those days that you can't do anything. But even if it isn't every day, do it for a few days in a row and when you are up to it. I had gaps in my tracking, but I was able to confidently say that there was a pattern to my pain, and also to truly provide an accurate number to my doctors when asked about my pain levels. That's all for this video. Please check out my other ones. Thank you.